This video will show you how to properly administer your medication by gravity. Please follow all instructions shown in this video. Administering medications by gravity at home can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge, and will visit weekly and as needed for your catheter dressing change and any labs that your doctor has ordered. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds. And dry as well. Use a separate towel to turn the faucet off. Gather your flushing supplies, the gravity tubing, the IV pole, medication, and any other supplies as directed. Prepare both pre-filled syringes of sodium chloride, also known as normal saline, and heparin if indicated by holding the syringe with the tip in an upright position. Gently pull back on the plunger, then gently push forward on the plunger to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Repeat with each syringe. Inspect the bag of medication for any leaks, particulate matter, and clarity of medication. Check the label on the medication bag for the correct patient name, drug, and frequency. Remove the tubing from the package and close the roller clamp. Remove the protective tab from the entry point on the medication bag. Remove the cover from the spike on the gravity tubing and insert the spike into the medication bag using a pushing, twisting motion. Hang the medication bag on the IV pole. Squeeze the drip chamber, filling the chamber half full. Prime the entire length of the tubing with medication by slowly opening the roller clamp. When a droplet of medication is noted at the end of the tubing, close the roller clamp and replace the cap. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse using a push-pause method. Disconnect the syringe. SASH method. S stands for sodium chloride. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Remove the end cap from the gravity tubing and attach it to the injection cap of your IV catheter by pushing and turning clockwise to secure in place. Administer the medication according to your Chartwell Plan of Treatment. To calculate the flow rate, slightly open the roller clamp and count the number of drops for 1 minute. Please refer to the table located on the back of Patient Teaching handout in the Welcome folder to identify how many drops per minute equal ordered rate. SASH method. A stands for Administer Medication. Monitor the infusion progress by observing the appropriate number of drops in the drip chamber. When the medication bag is empty and the drops of medication are no longer seen in the drip chamber, the infusion is complete. Close the roller clamp. Disconnect the tubing from the injection cap of your IV catheter. If another dose of medication is to be administered the same day, place a light blue sterile cap on the end of the tubing using sterile technique. If the tubing is not to be reused, discard it in an appropriate container. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse using a push-pause method. SASH method. S stands for sodium chloride. Disconnect the syringe. If your catheter requires the use of heparin, scrub the hub of your injection cap again with a new antiseptic wipe for 30 seconds. And allow to dry for 60 seconds. Attach the pre-filled heparin syringe to your injection cap and flush the IV catheter with the contents. Disconnect the heparin syringe. SASH method. H stands for heparin. All supplies and syringes can be double-bagged and disposed of with your household garbage. Wash your hands thoroughly for at least 20 seconds. And dry as well. Properly administering your medication via gravity at home is important to your safety. Please call 1-800-755-4704 if you have any questions or concerns at all while administering the medication. We are available 24 hours a day, 7 days a week. In the event of an emergency, always call 911.